I'm Kristen Kurtzinger, and I'm going to talk to you about the common mental illnesses. A mental illness is a condition that affects a person's thinking, feeling, or mood. There are more people than you would expect that has a common mental illness. According to the National Alliance on Mental Illness, 1 in 5 adults experience a mental health condition every year. I'm going to talk to you today about the 3 most common mental illnesses, which are anxiety, bipolar disorder, and depression. Now that I gave you some background information on mental illness, let's talk about anxiety. Anxiety is one of the most common mental illnesses. According to Anxiety and Depression Association of America, anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults in the United States, ages 18 and older. Anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. According to the National Institute of Mental Health, it states that anxiety disorder symptoms can include restlessness or feeling on edge as she is biting her nails, difficulty concentrating, difficulty controlling the worry, and sleep problems such as staying asleep, getting to sleep, or just not having unsatisfying sleep. Anxiety disorders are generally treated with psychotherapy, medication, or both. According to the National Institution of Mental Health, psychotherapy or talk therapy can help people with anxiety disorders. To be effective, psychotherapy must be directed at the person's specific anxieties and tailored to his or her needs. Medication, on the other hand, does not cure anxiety disorders, but often relieves symptoms. They'll have to go to a psychiatrist to prescribe the medications for this disorder. Now that I already talked about anxiety, I'm going to go ahead and talk to you about bipolar. Bipolar disorder is the second most common mental illness that you see in everyday life. According to National Institute of Mental Health, bipolar disorder is also known as a manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. This could also be a result from family history or from the brain function. People with bipolar disorder experience periods of unusual intense emotion, changes in sleep patterns and activity levels, and unusual behaviors. These are called mood episodes. According to the National Institution of Mental Health, some of the symptoms are extreme changes in energy, activity, and sleep can also go along with the mood episodes. The different types of medications that can help control the symptoms of bipolar disorder is mood stabilizers and atypical antipsychotics. Now that I've already discussed bipolar and anxiety, I'm going to go ahead and talk about depression. Depression is a serious mental illness that many people can look over. Depression is more than just feeling sad. It's a serious problem that needs the right treatment. An estimated 16 million American adults had at least one major depressive episode last year, according to the National Alliance on Mental Illness. On average, it affects more than 15 million American adults of the U.S. population ages 18 and older in one given year. And that is according to Anxiety and Depression Association of America. For most people, depression changes how they function day to day. Symptoms can include changes in sleep, changes in appetite such as loss of appetite, the loss of energy, hopelessness, or low self-esteem. To be diagnosed with depression, a person must experience a major depressive episode that has lasted longer than 2 weeks. According to Anxiety and Depression Association of America, treatment options include: first, you would do exercise, then you would also take antidepressants, go along with psychotherapy, because antidepressants can only help treat the symptoms, not the actual disorder. All three of these disorders are very serious and common in today's world. As you can tell, mental illnesses are more common than you think, especially anxiety, bipolar, and depression. They can range from moderate to severe, but they are all very serious. Now that you know about these disorders, you can understand what people with the disorder are going through, and you can help them out. Thank you all for listening to me today.